almost like, you can think of it as a golf ball on a tee. So that stalk is protruding, that tee is protruding out of the uterus, and there's a large fibroid on the end of it. Some of those women may not be a good candidate for the surgery because our fear is that when we cut off the blood supply to that fibroid, it can fall into a place that we don't like, for example, like into the pelvis. But we're talking about such a small fraction of patients there, about 1% or less, that I would say the vast majority of patients are good candidates for this procedure. Anything that would make you a difficult candidate for a large surgery, for example, patients who have trouble breathing, or patients who, for one reason or another, are not good candidates for the general anesthesia that's required for hysterectomy. All of those patients are great candidates for the fibroembolization because you don't have general anesthesia. You don't have to worry about a large, long, prolonged surgery. So to give you a short answer, essentially, very small, less than 1% of women may not be good candidates for fibroembolization, but the vast majority are going to be.
Okay, so now here's another question. This young lady said she had, and I say young lady, she had a UFE in 2008. And the fibroid shrunk, but she still experiences pelvic pressure. She's now 55 and postmenopausal.
Okay.
Is a hysterectomy her only option, or can she repeat the UFE?
So that's an excellent question too. So you can repeat the uterine fibroembolization procedure. What can happen is she had the procedure done in 2008, correct? And over time, so essentially in 2008, whatever uterine fibroids she had, when she had the embolization procedure done, all of those fibroids, the blood supply was cut off, they shrunk down, her symptoms improved. But over time, some small fibroids may have come about in a different location. So the ones that you kill off, they're gone, and they're gone forever. Those don't come back. But there is a small possibility that a fibroid appears in a completely different location with a different new blood supply. So in order to treat those patients, you can actually repeat the fibroembolization procedure, go in and just cut off the blood supply to that fibroid and allow it to shrink down just like it had done previously with the other fibroids. What I would advise is, one, she should get an ultrasound and a full evaluation to make sure that the symptoms that she's having post-menopause, once she's got, now that she's post-menopausal, that they are related to the fibroids. Because one thing to be, very careful with is patient selection. So we want to do, what I always strongly advise, especially for postmenopausal women, is have an evaluation by your gynecologist. Have a full understanding of what's going on and what's causing the symptoms. Don't just assume that this is related to fibroids. Make sure that it's not anything else. And once we've determined that, yes, your symptoms are due to uterine fibroids, that's when the fibroembolization procedure comes in, and we can, help by shrinking those fibroids. But it is very important to have a proper diagnosis, to have a proper evaluation, and we obviously help in that process and help in every step along the way.
Okay. Well, here's the $1 million question. The ladies are asking, do you take insurance? What types of insurance will cover this? And what's the approximate cost of this kind of a procedure? It sounds expensive, they're saying.
So the one thing that I'll say a couple of things on this topic. So one, I'm not an expert on insurances. But what I can say is that MIMIT Health has always been an organization that treats all patients. So whether you have like Dr. Walker, and we worked with Dr. Walker for a very long time, and she spoke to this very well. She said that, you know, whether you have Medicaid or you have a private insurance or you have Medicare, what have you, we treat all patients. And that just goes back to the principle of what we do as an organization, what we believe in. So our goal is to open doors, open possibilities, and figure out a way how can we treat our patients, no matter what type of insurance they have. The actual cost of the procedure, I don't know, because the vast majority of insurances cover it. So it's very, very little out-of-pocket expenses, whatever your deductible is, for example. So the out-of-pocket expenses are very low. But what insurance actually pays out, I don't know off the top of my head. But what I can say is that the best approach is to come in for a visit with us, figure out if this is the right procedure for you, and then let us help you figure out, you know, how to make this work. And we work very closely with patients. You know, sometimes, you know, I mean, there are patients that that will come back to us and tell us, you know, I went to so-and-so doctor and they denied me for this reason or that reason. And, you know, we take great pride in making sure that we take care of all patients.
Okay. Well, very good. And we got a lot of questions. The ladies are very active today. Okay. So here's another one. She says she has high blood pressure and diabetes. What are the risks to her and side effects?
High blood pressure and diabetes, very low. Okay, so that's an excellent question because it alludes again to the type of procedure that you're having done. This is not a large surgery. This does not involve a large hospitalization. It's a minimally invasive outpatient procedure that is very, very low when it comes to risk. So the number that I quote, some of the numbers that I quote are less than 1%. This is based on, you know, a lot of literature. Again, like I said, there's level 1 evidence for this procedure, meaning multiple clinical trials have occurred. So the data out there is very good on this procedure. In the literature, less than 1% chance of any type of major complications such as bleeding or infection, and 98% success rate in improving and getting rid of the symptoms that are associated with uterine fibroids. To answer her question, it would be a very safe procedure and probably the safest procedure she can have to treat uterine fibroids.
Perfect. So here's another. Is it possible for fibroids to cause blood clots in your body?
To cause uterine fibroids to cause blood clots in your body. So this kind of goes back to another question that we had related to circulation and what uterine fibroids can do in terms of creating abnormal circulation. So one of the main type of clots that can develop in the body are called DVTs, deep venous thrombosis, and they most commonly occur in your legs. Now, if you have very large fibroids that are pressing on the veins that are draining your legs and prevent the blood flow from getting out of your legs back to your heart, that venous blood flow that gets stuck in the legs, that, or slows down in the leg, that can form into a clot, and that can form what's called a DVT. So yes, if the fibroids are large, they are pressing down on your veins, they can cause clots in the legs.
Okay, so now we're going to combine a couple of these so we can get everybody's last couple of questions in. And this one is more, there's a young lady, she said she was told she had fibroids, but now every month she's nauseated, she gets diarrhea, she's physically sick, vomiting, and is all of this being caused by the fibroids? They put her on Lupron to reduce the fibroids, but she's thinking that this may be a better option. Another young lady is saying that she gets a hard lump around her navel when it's close to her menstrual, and they were told she had fibroids as well, and she's just trying to see, is this related to the fibroids?
So, you know, some of these questions are would require further evaluation. So you'd have to come into clinic. I would have to do a full history, physical, and get a much better understanding of, the timing of the symptoms, how often they happen, how long they last, etc. And actually feel to see, if I can feel the fibroids, because a lot of the times they're so large that I can feel them just with my physical exam. So, what I can say is that a lot of these symptoms that are being described of nausea, sometimes, abnormal bowel movements, etc., they can be related to fibroids. And that's because of, the fibroids pressing on the bowels. So you can for example, I think one symptom that you mentioned was loose stools or diarrhea.
Right.
Is that right? So now you can imagine a scenario where a patient who has a large fibroid is pressing up against the bowel. And depending on where it's pressing, sometimes the stool is getting stuck. And when it really builds up, the constipation builds up, etc., or, the movement of the colon, essentially, the function of the colon is altered, you can have bouts of constipation, you can have bouts of loose stools. So yes, that's how your bowel movements can become altered just because of the fibroids. Fibroids can also, they can, as they're exposed to different levels of hormones, there also can increase or decrease in size a bit. So maybe sometimes when you're at a certain point in your cycle, you feel it more. Just because of all the other changes that are happening with your uterus, those changes are also happening with your fibroids. So yes, to make it a shorter answer, a lot of those symptoms that you are describing can be associated with fibroids. But again, it's always very hard to make these calls just by listening to someone. You really have to do a full physical exam, spend a lot of time with them to understand, what's going on.
Okay, and our final question, and ladies, I know we have a lot and people are waiting and asking for how can they get an appointment. That slide is coming up, and if they can put that slide up right now while we're asking the questions, that'll be great, because people are definitely asking how do we get our next appointment. But here's our final question. With everything happening with COVID, how safe is it to come into your facility?
That's an excellent question. So, going to the hospital is a big deal. So let's say if you were going to have a procedure done at the hospital, like a hysterectomy or myomectomy, it's a big deal. You're being exposed to a lot of different bugs that are there, such as COVID, but also other bugs such as MRSA. All of our procedures are done on an outpatient basis. They're done at our outpatient vascular centers, which are COVID safe. And we have in-house testing to make sure that everyone that's there is COVID negative. And that testing is regular, as well as, all the precautions and guidelines that we put in place. At MIMIT, we take great pride in saying that the guidelines and the precautions that we've taken on and put in place are on par with the large academic centers, et cetera, because that is the most important thing to us, to keep our patients and our staff as safe as possible. From my perspective, I think, given everything that's going on with COVID, we are a very good option in terms of going to a place where you want to be safe from COVID.
Absolutely. Well, thank you so very much. And ladies, before we go, we're going to have a quick survey that we'd like for you to take. So please don't punch out right now. We want to make sure that everybody is on and have an opportunity to do that. And the slide is coming up with the information. Of course, you can always go to MIMIT Health, that's MIMIT, MIMIT Health.com, You can always log on there and find your information as well. So again, we thank you so much, Dr. Ahmed. You have answered every question, and you've been a trooper because the ladies had 26 questions today.
Thank you, Sandra. I really
So
appreciate
we've
it.
had quite a bit of questions, and they're still coming in. But we're going to have to wrap this up, and we do appreciate this. Oh, we even got one that says you're attractive, that they like you.
Thank you, Sandra. And the one thing that I'll add is, because we were talking about MIMITHealth.com, I do encourage everyone to go to MIMITHealth.com. We have, it's a great website that shows, all of our locations, and also a lot of patient testimonials and a lot of information about other work that we do, including treating uterine fibroids. It gives a lot of information on our physicians, and there's actually a portal, I believe, on the website that allows you to put in questions or request an appointment. So I really encourage everyone to take some time, take a few minutes, go to MIMITHealth.com, and we look forward to seeing you.
All right, that's MIMIT Health.com. That's MIMITHealth.com. Log on today and you can put in for your appointment and find out more information. But what we don't want you to do is just sit on this information. We want everybody to understand and recognize that you can start 2021 off fibroid free. So let's start off fibroid free by, and that's a tongue twister, fibroid free by logging on to MIMIT Health. That's MIMIT Health.com. I believe I just saw that slide. They took it down, but that's going to give you the phone number as well. And don't forget, like, there it goes. It's 708-486-2600. That's 708-486-2600. And you can, again, MIMITHealth.com. We want you to call or log on and make your appointment today. And you can start off 2021 fibroid free. That's amazing. So again, we thank you. So that completes everything for us today. We hope that this has been helpful for you. Dr. Ahmed, you've been a trooper. We really appreciate you. You gave us some vitally important information, and I think that the ladies will be able to make some decisions, some educated decisions now, just by hearing your information on today. We appreciate you.
Thank you. Thank you for having me.
You're more than welcome. And also, ladies, don't forget, we do have our survey that we would like for you to take. We appreciate you, and thank you for joining us, and you have a wonderful evening. God bless you.